small story about me. So I graduated from medical school in 2014. Gave my blood like all you guys in 2016 actually, yes, and did my first job in the UK as a non-training SHO in Blackpool. Worked there for a year, and when I was about to complete my year, all of my fellow my friends from medical school who got here, my close friends, all of them were going into core medical training. Coming from Pakistan, I had this tunnel vision of becoming a medical consultant. I didn't know what specialty I wanted to do, but I knew that I wanted to do medicine because that is what everyone does back home. So like all of my friends, I went into core medical training. They have replaced it with IMT now, internal medicine training. But anyhow, so I did my core medical training. I'm still a core medical trainee at the moment. I'm in my year 2 now, almost finishing in 10 days time. So I did my 2 years of medical training, gained medical experience, closely observed the medical registrar work, and I realized and recognized how hard it was to be a medical registrar, the dedication, the commitment that you have to put in to be a medical registrar. And I knew that I didn't have it in me. It's okay to know your strengths and weaknesses and always work towards that. And when I started thinking about being a medical registrar, I realized that I didn't even know which medical specialty would I even choose for if I were to become a medical registrar. And that is when I started thinking about what I wanted to do. And that is when I spoke to Naseer. I know he had always had an inclination towards GP training. So I started considering it. Started looking at the paths to become a GP versus the path to become a medical consultant. Now, GPs, you only do, you have a 3-year training route. You don't do as many night shifts. This applies pretty much to psychiatry as well, as Shah said before. The training should be enjoyable. It should be easy. It should be doable. So that's what I thought, and I started considering GP training. And also, let's have a quick look at what the GP does within a day. So GPs do clinics throughout the day. They do phone call triage, which means that they speak to patients who are at home, who are poorly, and they need a doctor's review, but that can be done over the phone. And if need be, I've written home visits during lunch hour, but GPs, different practices run differently. So some GPs do home visits during the morning, some do home visits during lunch hours. So GPs go to homes and review patients at home, and if need be, refer those patients to hospital. As a GP, you don't really see acutely sick patients, and if you do, you can always refer them to A&E. If somebody comes in with a chest pain, you can do an ECG. If your prime diagnosis is an MI, or they go to A&E. As a GP, you're a generalist, so you deal with patients who are pregnant, who are expecting, you deal with toddlers, infants, up to patients who are in their 90s, probably in the last days of their lives. So you deal with a wide aspect of patients. You deal with patients who come in with ophthalmological problems. You can always refer them to Kimberly. If they come with psychiatry, you can refer them to Shah. So not just that you deal with the physical problems, you also try and deal with the social and psychological aspects. So you have to be good in psychiatry as well, I believe, before you make a referral. I believe a very important GP and also advocating for Shah here, psychiatry. I think these two are the specialties which will probably give you the best work-life balance. That doesn't necessarily mean that GP is for everyone. If you enjoy being an OBGYN, if you enjoy that, you should go for it. But if you're unsure and if you want a good work-life balance in between your career and your home life, I think GP is the way to go. So after realizing all this was my aha moment. So training structure. So it's a 3-year training route. Half of that is based in a hospital setting, in which you would do medical specialties, You can be you would do either 3 rotations, 6 months each, or you would do 4 rotations, 3 months each, yeah, something like that. So you would do 18 months in total in the hospital. You would also do, you might be able to do surgical specialty, like surgical post within that as well. You might be able to do ENT, ophthalmology, you might be able to do palliative care medicine or ortho. It depends on which deanery you get into and what hospital post that deanery offers, okay? And then the next 18 months you would spend in a GP practice. And what you do is you would get a GP trainer, you would see patients, and then you would discuss these patients with a GP, and basically try and learn how to be a GP in the GP setting. And you pass your MRC GP exam. Would not go into detail regarding MRC GP. There's two steps. There's a CSA and AKT, as Aman mentioned before. But I don't think this is the time right now to discuss that. But anyhow, so you need to pass that to gain a certificate of completion of training and be a GP. Within the training, what you do is you get an education supervisor, but this pretty much applies to all the trainings. So you get an education supervisor when you're in the hospital. You will get a medical consultant who will supervise you, will tell you what your weaknesses are, what your deficiencies are, how to improve them, when to appear in the exam, how to appear in the exam, which question bank you should do. They will also look at your clinical skills and guide you on a personal level what you need to do to improve them. And then again, workplace-based assessment, this applies to all of the training pathways. You see patients, you get them reviewed by a consultant, and you make sure you get that thing signed off. For example, you see a patient with chest pain, you would clock that patient, you would present it to a consultant, and in your portfolio, your online portfolio, there would be a tick box for chest pain patient, and then you would get it signed off with your consultant. So all of this is maintained in an e-portfolio. At the end of the year, you will sit down in front of a panel, and that includes your heads within the deanery basically. And they will look and see if you have done enough within the year, and that is called as Annual Review of Competency Progress, or ARCP. So you have to pass your ARCP to go on to your next year. When you move into your GP setting or GP post, the 18 months of GP, you get a GP consultant who guides you with respect to what the etiquettes are of a GP setting, how you should see patients, what are the red flag signs, how to do safety netting and all that. So all of the personal guidance, personal tuition, but with regards to GP. So recruitment. Recruitment is managed by the GP National Recruitment Office. So that's the body which monitors this or manages this recruitment. So it happens 3 times a year. So training begins in August or February. If you want to aim for August, you need to apply for round 1. Now, this resident labor market test has been discussed before. It doesn't apply to psychiatrists, it doesn't apply to GP. You can still apply in round 1, regardless of what your visa status is. So for example, we'll take an example. So I'm starting training in August this year, so from next month. So round 1 opened last year in November. So that was round 1. So round 1, I applied in round 1, sat through the exam, the steps of the exam, which we'll talk about in a second. Secured my slot in March this year and will be starting training in August. You get the result of if you have made through or not. You get that result by February time. So in February this year, I knew that I had made it, but my friends who did not, they had a chance to reapply so that they could begin training with me in August. That is known as round 1 re-advert. So round 1 re-advert, it starts I think in February. So your applications go in February or March. You can look it up on the GP website. If you still fail that, if you still are not able to make it into round 1 re-advert, what you can do is go into round 2. So round 2 applications will go start going in the next 10 days. So I think 30th of July is the date when the round 2 begins. The training will begin in February 2020. So next
Training too hectic and
Yeah.
partnership with GP.
I wouldn't say core medical training was hectic. The hospitals, the 18-month hospital setting post within a GP training is the same as core medical training. So basically I will be doing core medical training again for the next year and a half. What made me shift was seeing how bad it was for the medical registrar. I don't know the guys, I'm not putting you off IMT. Some of you will be more passionate than me, more dedicated and more better clinical knowledge than me. Okay. So it's a very subjective decision, but for me it was the dedication, the commitment, the sacrifice, and I don't think I was up for it. People come to medical registrar for all sorts of problems. A medical registrar friend of mine who was working in London got a random phone call from within the hospital saying, "There's a fox within the hospital. What do you want me to do about it?" He said, "No, I'm a medical registrar. Why are you telling me this?" And he said, "You're the medical registrar, you should know this." So you are the go-to person for everyone. And some people enjoy.
I have seen that the doctors also have this 10-minute window period. And like,
as a GP, you're going to see this patient 5, 6, 7 times over the period of 3 to 4 months. Now, they're going to be, yes, it's 10 minutes, you might have 3 hours to see 18 patients, but the reality is a couple of patients will take 2 minutes, 3 minutes. There'll be a conceptive pill check, there'll be something that's quite straightforward. And if you need to spend time with a patient, you can take 20 minutes, 30 minutes, because you'll catch up. So it's not that you have this 10-minute window, and if you don't achieve anything and you miss something, it's game over.